right, let's go. All right, we're live. Can we have the music go down? Messiah, I'm waiting for your thumbs up. All right, it looks like we are live at the City of Oakland's second COVID-19 Town Hall. And tonight we have some amazing experts to answer your questions. And we have seen a lot of questions come in from you, understandably. This has been now a little more than a week since a state of emergency was declared in Alameda County, the city of Oakland, as well as in the state of California. And again, I want everyone in the Bay Area to be proud that we were the first region in the entire country to declare a shelter in place. And while these are very frightening times, we do have some signs of hope that these extreme precautions that we are taking right now through our shelter in place are working to flatten the curve. I want to first of all thank our hosts tonight, and that is Beebe Memorial Cathedral, for hosting this second COVID-19 town hall. They also hosted our town hall last week. They have an amazing live stream capacity, but mostly they have incredible faith and a spirit of giving that benefits this whole community, and that is under the leadership of Dr. Charles Hames. Thank you, Pastor Hames. Thank you, Beebe Memorial Church. We also want to express our deep gratitude to the frontline workers. And as the mayor of Oakland, I need to give particular gratitude to our first responders. The people who are still showing up when you call 911, the people at the front lines of our hospitals, the people at the front lines working with our unsheltered populations. They are subjecting themselves every day to risks and uncertainty, and they show up anyway. Thank you. We are all so grateful to you. We know that this is a moment where we can take this seriously and do what we need to do to save lives or not. And I want to highlight in particular this week a lot of concern over use of our outdoor spaces and parks. There is a lot of talk amongst cities and different levels of government about shutting down parks. In the city of Oakland, for now, we are keeping parks open. But that will not continue unless people take social distancing directives seriously. Parks are not for gatherings. They are not for socializing. They are not for playing on playground equipment. That is unsafe under these conditions. But parks are for walking with your family members or household members, for running, for biking, for exercising, for breathing some fresh air, something we all need to keep our mental health good during these uncertain times. But please take these restrictions seriously, or we will have to shut down our beloved parks. We have got to, as they say, be prepared to go through hell before things get better. And we have to acknowledge that in Alameda County, we have lost 4 loved ones from our community to this virus. That is serious, and we grieve and send our prayers out to the family and friends of everyone who has suffered a loss or is suffering from this virus. We just saw schools announce that school closures are now extended to May 4th. May 4th, another full month with children at home, and that causes a lot of concerns, disruptions, and also opportunities for families to be together. So these are some of the things that we should be prepared for as the current shelter-in-place order has not been officially extended at this time, but it is something we should all be prepared for. This week in Oakland, we will open our second testing site for first responders and the frontline workers in Oakland. And starting tomorrow, we will also be allowing the first responders and frontline workers in our neighboring cities to use the sites. This is a time for us to be in this together, to see ourselves as an interconnected region that is absolutely dependent on one another. And this is a great example of it. And I really want to thank all the hardworking staff in the city of Oakland that has stood up those sites. Alex McBride is here tonight. I know she's worked very hard on that, as well as generous donors from the community that have put private funds in to help us make these testing sites available in Oakland. We also have started to open the just under 400 hotel rooms, thanks to the state of California, that were secured to take our unsheltered off the streets who need to be put into safety and care. We know that the first resident just moved in today. We also are going to be accepting from the state of California 91 FEMA emergency trailers. These are like RVs where we can put additional unsheltered people that need to be isolated due to medical concerns. And again, we are sharing half of those trailers with other cities in our surrounding Alameda County. And next week, we'll be launching our Emergency Business Fund, which will offer small grants to our most struggling small businesses. Our Oakland COVID-19 Relief Fund just reached the $4 million mark. What a generous community. And we are working hard to make sure that this fund is helping our most vulnerable residents and that we are getting these precious funds out into the community quickly to have the biggest impact on those who need it the most. Finally, I just want to end with a story of hope before we go through my little deck. I am so proud to be an Oaklander. I've never been prouder. This community is full of so much generosity, so much compassion, so much hopefulness, and it inspires me every day. The little acts of kindness, the grocery stores that are delivering for free to seniors, the people that are sewing masks for our frontline workers to wear. These are things that really show the best of us in moments like this. Nonprofits like the Roots Community Clinic that runs a soap company called Clean 360 revised their factory so that they're manufacturing hand sanitizer right now. That is a wonderful silver lining in this dark cloud of COVID-19. And with that, I want to do a quick set of slides to just give you a quick overview of basic information that we believe will be helpful for you during these times. Just a reminder, what is open and what is closed. Stay at home, stay safe, and only go out for necessary activities. Next slide. We wanted to give you an honest look at where we are as of today in the state of California with regard to preparing for a surge in our hospitals. The governor identified a need for additional hospital beds, and I want to say that I just got off the phone an hour ago with the 4 major hospitals in Oakland, and they really gave me a sense of confidence that surge plans are in place, they are being implemented, and that we have some of the most incredible medical professionals right here in Oakland. Next slide. This slide shows that we have reason to be hopeful that what California did is making a difference. When you look at the number of cases in New York State, which implemented their shelter-in-place order after California and long after the Bay Area did, you can see that there is data suggesting that what we have done has saved lives. Next slide. All right, I already gave my admonishment about the parks. Please help us keep our parks open by maintaining a 6-foot distance from everyone. Wash your hands before and after you are outside in the parks. And of course, cover your mouth with a Kleenex or your elbow whenever you cough or sneeze. Next slide. Again, every Oaklander, every human being is encouraged to donate. No amount is too small to oaklandfund.org. That is our Oakland COVID-19 Relief Fund. That is what is making these testing sites, at additional sanitation at our homeless shelters, relief for our small businesses, meals for our seniors. That is what is making it possible, is donations to this fund. Next slide. Tomorrow, our Oakland City Council will be having its first virtual meeting under new meeting laws, and they are expected to enact a moratorium on evictions. We'll hear more about that later. Next slide. Again, please visit oaklandbusinesscenter.com for resources for small businesses. And if you have a small business, please fill out our survey to document what type of losses you are experiencing. This is the information that we will be providing to better inform our policies going forward, as well as to look at potential candidates for that business relief grant fund. Next slide. Don't forget, stay in and order out. Restaurants are still relying on our ordering from them to keep them in business. And now you can even have cocktails delivered to your home. Something that a few of us probably need. Next slide. All right, again, oaklandca.gov, where you can keep updated. Next slide. And don't forget, when you're bored at home, you can fill out your census. It's census time, and you probably don't want someone to come knock on your door. So please, fill out the census. The times like this remind us how important federal money is. For each person who fails to fill out the census, that will be $10,000 of loss to this region for vital services, things that we are really needing right now. Next slide. A reminder that Oakland Unified School District is still doing grab-and-go meals at 12 different sites all across the city. These are available on Mondays and Thursdays, and they're now adding dinner, they're adding lots of groceries, they're even in a few sites providing, I think, some diapers and hygiene items. So this has been a phenomenal resource for families. Your child does not have to attend an Oakland public school for you to take advantage of this resource. Next slide. All right, that wraps it up for me. We have received hundreds of questions from you. We have tried to consolidate them and allow you to vote on the questions that are of greatest public interest. We are going to start with some general questions about city services with our Chief Resilience Officer, Alex McBride. Thank you, Alex. Alex, you've been working so hard during this whole thing. And again, I'm really proud that Oakland actually has a community resilience branch of our emergency response structure. A lot of cities don't have that. We should be very proud that Oakland has that, and you are just doing an amazing job of serving our community.
Thank you, Mayor. And I'm one of many colleagues who are working in our Emergency Operations Center a lot to try to do what we can to support this work. So again, my name is Alex McBride. I'm the Chief Resilience Officer for the City of Oakland. I've spent a lot of my time here in my position really thinking about how to build community ties with as many organizations and individuals as possible, so that in times like this, we can mobilize quickly and focus on those most vulnerable. And there are a couple of things I want to talk about that happened first this week, and then we'll get into some questions. Just a couple of highlights since we spoke last week. As Mayor Schaaf mentioned, we now have first responder testing sites in place, one of the first cities in the nation to really provide that service for our first responders. So far, we have tested over 150 first responders, and right now we're identifying or defining that as our Oakland Police, our Oakland Fire, as well as our staff that are performing essential services. And now, as Mayor Schaaf just mentioned, we're opening up that site to also bring in the first responders from our neighboring agencies. So we're excited about the existing partnership there and the opportunity to build more sites. We'll have ideally our second site coming out next week to test a broader population. We are dealing with the same national kind of trends of access to tests. So we're trying to do what we can with what we have, but also I want to mention the Oakland COVID-19 Relief Fund as an important factor that helped us fund the first test site and for the second site. Another win, as I kind of mentioned, is our trying to work as closely as we can with the Relief Fund and providing guidance and input into how we can mobilize those resources as quickly as possible to the communities that need it most. We've heard Mayor Schaaf just mention the business center, oaklandbusinessassistance.com, and I will get that website right if I miscommunicated it just now. But that's where we're trying to get all of our small business owners in on the website. We've had the staff of Economic Workforce Development individually call about 800 different people who responded to the survey to get more information about their needs. And we're using that insight to then help direct and pivot resources directly to small business owners. So please be sure to fill out that survey. And then the third sort of component of the work we're doing, as Mayor Schaaf mentioned, when the city declares a local emergency, excuse me, we activate our Emergency Operations Center. That kind of puts our organizational structure a little bit on its head and tries to streamline the way we work. And when we do that, it's a great way to get everyone in the same room, but we also have to, as a team, learn to operate in this new way and with this new branch around community resilience. So the last few days have been a lot of great collaboration with my city employees. We've done a few things. One, because we've been hearing so much from the generous Oaklanders about donations. We're trying to be as streamlined as possible on how to bring those donations in as easily as possible and deploy them where they're needed. We did set up, thanks to partnership with our libraries, the main library is accepting certain supplies right now wrapped in 95 masks. You can drop into the main library book return box, and you can check their Twitter about that. And we may be using the library to ask for other supplies, so you can kind of keep an eye on that. And then for volunteers as well, we're having a lot of interested folks who want to come and volunteer. We're trying to be as conscious as possible to make sure safety is number one. So wherever we are sending our volunteers, we want to make sure we're aligning with the health guidelines, and also try and deploy volunteers where they need most. So we as a system are building up, and hopefully in the next few days we'll have some really clear guidance on other types of donations. But stay tuned to our oaklandca.gov site, our Twitter, and I guess our next town hall, we'll share more updates. So I'll then just kind of jump through a few questions, some that we've kind of talked about or the mayor sort of addressed. So the first question, or I think is the most popular one, can the city provide temporary facilities for medical workers who do contract the virus and do not want to infect their families? That's a great question, and it's an example of a resource that we are currently working on right now. We've had a community leader step up and offer a facility to use for the scenario where first responders have to isolate and don't want to subject their families to the potential virus. We are in conversations right now and hope to maybe have a public update. As of now, we haven't needed that service yet. We've tested over 150 people. Two have been marked as positive for the virus, but have isolated at home. But it's good to have this as a resource for future incidents if we do encounter more positive results. The second question, we should all be in this shutdown together and the situation is completely unjust. Is there any discussion of deferring debt collection like is being done in some of the other hard-hit counties or countries right now. I do want to, I guess, first refer to the city council meeting tomorrow, where we are talking about the moratorium on evictions as one potential way that we're working on sort of thinking about economic issues in this time. I also want to point to the fund as another resource. So we're working not only for small businesses, but also trying to identify those communities that are often hit hardest in disasters. So these are those impacted by racial disparities, the undocumented, low income, unsheltered, and we're trying to not repeat what sometimes happens with systems where the injustice continues. So using the fund and our resource delivery as a way to really challenge ourselves and ensure that we're not leaving any communities out of our service
And
is
Alex,
critical.
if I can just jump in, the governor announced yesterday that the banks, except for Bank of America, shame on you, Bank of America, are going to be giving, I believe, is it a 6-month extension on mortgages? A 6-month holiday on paying mortgages. And then the federal government has announced a delay on taxes due to July. I know that all the mayors in Alameda County are getting ready to ask the county to do the same. So there is some work going on, but I believe student loan debt has been addressed at the federal level, and mortgage payments have been addressed now at the state level. Except for Bank of America. Shame on you, Bank of America. Did I say that?
Yeah, so that's an excellent point. There's so much happening on so many levels of government. We're trying to use our oaklandca.gov site not to just point to what we're doing here in the city, but also to the mayor's point, county, state, or federal resources, as well as the private sector that's really stood up as well. And then the last question is around business owners. Where there'll be financial assistance available to self-employed business owners. And I would, again, direct those questions to the Oakland Business Assistance Center.com.
Oakland Business Center.
Thank you, oaklandbusinesscenter.com, to please fill out the survey, talk about your impacts, and we'll be in touch because we are trying to get as much information as we can so we can pivot the fund effectively.
Great. oaklandbusinesscenter.com.
Thank you.
Thank you, Alex. Again, we're going to circle back to everybody at the end of these initial questions. So if you didn't get your question answered, don't worry. We will be circling back, taking your questions live that you're posting on Twitter, Facebook. Please keep those questions coming. Next up, we are going to have someone who I think is going to be really in history recognized as one of the unsung heroes in this entire episode, and that is our health officer for Alameda County. Again, this is one of the 6 health officers that were the first in the United States of America to declare a shelter-in-place order. So it is with great gratitude that I introduce our health officer for Alameda County, Dr. Erica Pon.
Great, thank you so much, everyone. It's really an honor and a pleasure to be here. And again, my name is Dr. Erica Pon. I'm the Alameda County Health Officer, and I also actually see patients at Oakland Children's right here, and I'm a pediatric infectious disease doctor, and I live here in Oakland. My kids go to school in Oakland, so I'm a very proud Oakland resident. And yes, I'm here to talk to you more about what we're doing as a county public health department. So this is our 10th week, actually, of a department operations center. We activated in January as we were monitoring what was going on in China, and once we knew that there were going to be screening of travelers coming in from airports. And just recently, our emergency operations center for the whole county has been activated as well to support us, which has been hugely helpful. I declared a county health emergency on March 1st when we had our first case of COVID-19, and things have continued to rapidly escalate since. And as just mentioned, we were among the region in the United States to declare a shelter at home or shelter in place in order to really try to flatten this curve. We were seeing, especially from our neighbors in Santa Clara County, who really had the first couple cases and a few days ahead of us on this, we're really starting to see the impact and the exponential increase of cases just in their county. And we, thankfully, as a region, really made this unified decision. And I will acknowledge it was an incredibly hard decision. I am really thankful that I think we made the right decision. But I know this has had a huge impact, as we're talking about tonight, on our entire community. Just to give you some data and numbers, so we are up to 164 cases here in Alameda County. We, as Mayor Schaaf mentioned, we sadly have had our 4th death. Just 2, 3rd and 4th were reported yesterday. And then there are 14 cases in the city of Berkeley, and I'll speak to that, and I know there were some questions about this. So the city of Berkeley has its own health department. They have their own health officer. They are one of 3 cities in the whole state that has their own health department within a county. So I work very closely with Dr. Hernandez, and our health departments work very closely together, but they do have their own sort of health jurisdiction. So that's why numbers are reported from them separately and not from other cities. And to speak to other trends, again, we only had, I think, less than 50 cases just last week, and we have definitely tripled in the last week. So I do think, again, that rate of rise would have been faster if we had not issued the shelter in place, although I also want to say, just for people to know, a lot of people are asking, are we seeing an impact? And we think we might from some of this data compared to places like New York, but the way the virus works, the incubation period is anywhere from 2 days to 14 days. So, and most of the time it takes at least 5 or 6 days. That's the median incubation period. So really we would start to really see the impact probably around this week. So we are monitoring very closely, again, the rate of rise of cases. We're monitoring the bed capacity across the whole county. We actually do bed polls every day. And starting this week, the state is actually monitoring across the state how many beds are taken up with COVID-19 patients, how many ICU beds. So we'll be monitoring that in the county along with the state as well, and looking at our 911 calls. I will say, thankfully, right now, we are not seeing a surge yet. We are, again, watching that very closely, I think, and we are actively looking for other alternate care sites and how we are working with our hospitals, as mentioned, across the county to think about their surge capacity as well, and also working with other partners, including long-term care facilities and clinics, to really think about surge in our whole healthcare system and the continuum of care in the system. And then to speak to testing, I know there's a lot of questions about testing, and hopefully in a broad scope I'll answer some of your questions, and then I'll look again at some of the other ones I didn't get to. In general, as the reason that this question is here is it's been limited, and very early on in any new novel infectious disease, when there's the new technology for it, it generally comes in the public health system. So when Zika virus first came, you could only send testing to Atlanta, the CDC, and same with Ebola, and the same was with this virus. Thankfully, we got testing fairly rapidly in the state of California, since we were one of the first states hit. And then we in Alameda County Public Health Lab also are doing our own testing, but it is still limited as far as the public health lab testing network. And then there are commercial labs that are gradually getting up and running. So again, I think every week and every few days we hear about another lab that is approved to run and then has started running. And of course, because there is a lot of demand, I think, again, they're getting up and running, but there's still a lot more demand than capacity. I do see it increasing every week for sure, as far as not only the number of new labs that are up, but their capacity. So some labs came up last week, and then they've increased how many they can do a day. I also issued an order. I can't keep track of days lately because COVID-19 time is surreal. But I recently also issued an order to make sure that that our public health department gets all the tests, not only the positive tests, but the negative tests. Because the other thing that's really helpful for us to monitor is the % of positive that we're seeing in the community. So we will be monitoring that. But again, not only is it taking time for the different labs to get up and running, it then takes them time to make sure that they are reporting appropriately to the public health department so we can actually do public health surveillance. Some of the large labs that are already very established have electronic links to the statewide lab reporting system, and so some of those will come in more quickly than others. But there's a lot of operational issues that need to happen before all the pieces are in place at the end stage where you all as citizens who have symptoms who want to get tested can get tested. Again, we really largely want to work within our healthcare system because then you can have a provider that can follow up with you, talk you through, and report to us to make sure that you are appropriately isolated and that your contacts are quarantined. But it is exciting to see these new initiatives and working with other entities to do other innovative testing. And I think the other reason, people may know this, but just to highlight the reason why sort of the drive-by is helpful and important is initially we were really only saying the testing was only safest in an airborne isolation infection room, and those are really only generally available in hospitals. And we realized quickly as we were seeing more disease in our community, we needed to open up that capacity. So a lot of clinics don't have those kind of rooms, and so the safest thing for the healthcare workers, who, as you know, also have had a combination of not enough personal protective equipment, but we want to keep our healthcare workers safe so that we can help take care of ill patients. So the safest thing to do is have the right personal protective equipment and be outdoors, and this drive-by has been a nice innovation to be able to do that test right there in the car, so long as the person is not very ill and doesn't need more clinical assessment. So again, it's great to see these other systems. I think we are putting out sort of a statement or memo. I think we'll have this ready tomorrow to really talk about all the elements we'd like to see in place to make sure that we're getting the data as well, so we can integrate it into our local public health surveillance system, be able to monitor those trends and help make sure there's appropriate follow-up. So in the meantime, I think really we've been also trying to let people know, and of course, again, we want everyone to shelter at home and do this social distancing, and that if you are ill, it's even more important to not even go out and do any kind of essential activities and really make sure someone else can do that for you or you can get things delivered. And because there is a lot of COVID-19 in our community, I think anyone who has symptoms of fever, shortness of breath, or a cough, or even other respiratory symptoms could have COVID-19. It just is here in our community. And I also want to remind you on that same note, over 80% of people will have mild disease. So it's a mild disease, but obviously it causes very serious illness in the elderly, the people who have chronic underlying conditions, and that is exactly why we want to minimize that and protect our most vulnerable, protect our parents and our grandparents and all the people we love. But the vast majority of healthy people will do well. And just like with flu, sometimes healthy younger people can get really, really ill with flu, and that's true with this disease as well. But I do want to reassure people this is a very serious pandemic, but for the most part, most people will have very mild illness. And then to talk more about the shelter in place. So again, we issued this on March 16th, and it was effective March 17th, so we're a little bit over a week into it. And I know there's some questions about compliance. We really have been so impressed and thankful and amazed how the community has come together on this. And for the most part, we're really just trying to educate people about the importance. I think as time goes on, if we don't see the right flattening of the curve, and as we've been looking at different modeling around, what percent are we reducing the people's interactions, we may need to do more enforcement. And we're really working closely with, not only our county law enforcement, but cities to answer questions about that too. We just updated our frequently asked questions on our website, AlamedaCountyPublicHealthDepartment.org, acphd.org, for various questions about sort of compliance with the order. And again, we're trying to balance minimizing non-essential person-to-person contact to flatten that curve, but also let you all have, we all want everyone to be able to be healthy and be safe and get food and get outdoor activity in the parks. So I think, again, we are really grateful for all of our partners in the cities and East Bay Regional Parks District trying to keep the parks open so that people can get good outdoor activity. I know it's hard. I have kids as well, and they need to get out. We want to exercise, but we need to do it, again, safely so that you're not interacting with other people outside your home. So 6 feet apart. Please do that. Please don't congregate at picnic tables. That's what I've been hearing has been a big issue. And we are going to, have to crack down and decrease access if people cannot comply with the social distancing. But we really want to keep our parks open and keep people healthy and exercising outdoors. I know a lot of people had questions about the schools. So we, again, the same 7 jurisdictions, and I think others have followed again, came together with our county superintendents and the health officers to talk about the schools really wanted to make a plan and, of course, need to make a plan for if they're going to continue distance learning or what they're going to do. So we made that decision first because in a lot of these social distancing models and other things, you can look at that as one component versus others. So we did decide to go ahead and extend that to basically what is roughly 8 weeks from the time we first started. And a lot of the data from prior pandemics shows that 8 weeks is another time frame where you can see an impact. That's why the school decision was made first. We are actively looking And again, and there's a lot of different models out there. We're trying to use the best epidemiology and science we can. Everyone from the state level, and again, as a region, we're looking very carefully what we know. It's a challenge because, again, I mentioned already, we would see we'd see more of our known impact probably next Tuesday would be like when we'd see more, but we also know that everyone wants to know what's going to happen next. So we're actively looking at those things and discussing and looking at different scenarios of how much we think the compliance is around the social distancing, how do we flatten that curve, when would we reach that potential maximum in the amount of hospital beds or ICU beds we have, and looking at different measures around the social distancing. So we do realize that we have that April 7th date on there, and we're hoping by next week to be able to have more communication to our communities about what is next and what we think will happen. I will manage expectations to say it's not like I don't think just after 3 weeks we're just, and I know there's some other elected officials who are saying otherwise, but it's not like everything's going to be able to return to normal, but I think there are different scenarios of actually being more restrictive or enforcing more, or maybe certain things could change. So we're going to be looking at that, and again, hope to communicate more next week. And what else did I want to tell you? I can't remember if I mentioned there's a compliance email for Alameda County, and I can send that later to get shared on the Oakland websites as well about compliance questions around the shelter in place. So again, I want to just really provide a huge thanks to this community. It means so much that at the city, county, and regional level, and as a whole nation, we're going to get through this together, and I know it's a really hard time. And again, we did not take this decision lightly, knowing all the economic and social impact it has, but I do think we made the right decision, and we will keep everyone posted on how we can demonstrate that. But I want to thank you all for participating in this with us. So some of the questions that came through about health. So I know people, again, and I started to touch on this, but why do we not know how many why are we not publicizing how many people in Oakland versus other cities? So again, Berkeley has their own health department, so they receive the data differently, and the way healthcare providers report that data is by the jurisdiction where the person resides. We are certainly looking at that data, but we have a lot of rules based on our epidemiology and our statistics. When we have numbers that are very small within a specific city, there's a couple things. We don't want to the public and the media, more importantly, often go sort of looking for specific individuals when the numbers are small and have various clues. And so we really want to protect confidentiality. And we think the most relevant message right now to everyone is, again, people who have mild illness could have COVID-19. And right now, for sure, what we want is everyone to stay home in general. We are looking at those trends, though, and also the testing, because it's been so difficult to get. It's not necessarily a strategic testing right now, so we don't know that the test numbers are exactly representative of the burden of disease in any specific city. So that is why we are not reporting right now by cities. I think as the numbers grow, that may change, but that's some of the rationale behind that. And then what are we doing to assure there will be enough medical supplies, personal protective equipment, beds in hospitals, and staff when COVID-19 hits hard? So that's exactly what both our Department Operations Center for Public Health and the Healthcare Services Agency and the Emergency Operations Center are working on. And we do have a resource request process for the cities to submit and the hospitals directly submitting to us. And again, we can provide the link to link on the Oakland website as well. But any resource requests about personal protective equipment and other medical supplies can come through that. And we have a whole process. We look through some caches that we have had. I think we've pretty much, as far as personal protective equipment, given out any caches we had. And then we make a resource request to the state, and we just got another shipment, and we are actively distributing PPE to the different hospitals. And some of these models also have like a burn rate that we're kind of putting into the equations as well as we try to think about what our surge needs are. And so that's how we are monitoring all of that, PPE and the beds. We have a system called ReadyNet here in Alameda County. A lot of other jurisdictions use it as well, where we can look all the time at sort of the hospital status as far as the emergency rooms, and we do these bed polls every single day to see how things are looking in the system. And planning, again, as I mentioned, looking for alternate care sites and working with our healthcare system on how to surge and expand, and how we can, for example, decompress the hospitals and maybe find other places that people could go, whether it's a empty, unused beds in a skilled nursing facility, or, we're also working closely with the hotels and trying to get more spaces that could be a combination of the other important factor for public health is isolating people when they're ill. So we're hoping with these, getting more hotels online to house not only the homeless, but also potentially people that need to be isolated, that don't have a place where they can be safely isolated away from others. And I believe, so this other question is similarly about what are we doing for our hospitals. So we have a disaster preparedness health coalition that has been meeting for decades, and we meet with them. At some points it's been monthly, and sometimes it's been quarterly, and we actually had hired a surge consultant several years ago to think about this very scenario. So we're using that framework and refreshing it with our hospitals, and that's how we're working together to manage the potential surge. I did touch on testing again. I think there's no magic date I have for when there's going to be more testing available, but it is increasing every day, every week. And I think it's really important again too to know because right now there isn't a treatment and most of the disease is mild, the main thing it would change is that people need to stay home. And again, we're really wanting everyone to stay home and away from others right now. And as far as shortage of masks and gloves, those are things that can be requested in the resource request process as well. And
Dr. Pon,
sure.
we will circle back to you
sure.
to get more questions live as people listen and think of other things.
Sure.
But what I definitely heard you say is we shouldn't be so worried about testing if we're staying home.
That's right.
And that you will know if you need to go to the hospital. And that's what we want to do is save that precious resource for the people that need it. I do also want to thank you. You were very helpful during the Grand Princess cruise ship episode. Dr. Pon really made sure that our workers, particularly our ILWU brothers and sisters, had adequate protection and that all the best health protections were being used for the passengers and crew that Oakland helped get back home to their loved ones. So thank you again for your work with that.
Yeah, happy to do that.
I do want to correct something that I said that was inaccurate recently. I apologize. The mortgage vacation or mortgage holiday from the banks that was negotiated by the governors, I'm afraid is 3 months. I apologize. I said 6 months. That was over-optimistic. 3 months. And Bank of America is actually offering a 1-month holiday for their mortgage holders. Next up, I'm going to be introducing Jenna Jerry. She is with Legal Aid at Work. She's going to be talking about what kind of benefits and rights that workers and all kinds of workers, not just employees, because this is the Bay Area. We got a lot of gig workers out there, a lot of independent contractors and sole proprietors. And then just to get you excited, next up on deck after Jenna, we're going to hear from Shanae Franklin-Minor, who is the program manager for our rent adjustment program in the city of Oakland, to talk about tenant rights and landlord obligations right now. And then after her, we're going to hear from Daryl Dunstan about how we are serving our unsheltered residents. So Jenna, please, I know there are a ton of questions, and I just saw some really interesting statistics about how many, like 4 million people just registered for unemployment benefits. It's like an all-time record by many, many times. So hopefully people should find some hope in that. Tell us what workers need to know, people who are without income right now.
Yeah, thank you so much for having me. I'm glad to be here and to share this information. As you said, my name is Jenna Gary, and I'm a senior staff attorney with Legal Aid at Work, also a proud Oakland resident. So things are different right now. Last week, there was 3.2 million unemployment insurance claims filed. We've never seen anything like that in the history of the program. So I'll start just giving some brief information about Legal Aid at Work and the type of resources that we can provide, and then go into kind of a brief overview of current laws and programs that are available for workers. So Legal Aid at Work is a nonprofit based in San Francisco, but we serve the entire state of California, and we represent and advocate for the rights of low-income workers. All our services are free, and we also represent you no matter your documentation status. We offer free legal advice and several Know Your Rights materials online at our website, which is legaladdatwork.org. Particularly right now, we have frequently asked questions related to coronavirus that is currently available in English, Spanish, and Chinese. So if you don't get your question answered today, or if there's something I missed, I really encourage you to go to our website, which will provide you with some great information. Additionally, our organization offers virtual and phone-based workers' rights clinics where workers can talk to someone and get personalized individual legal advice. So you can call, it's 415-404-9093 to schedule an appointment. So let me just give a brief overview of California programs and laws that may be able to help you during this public health crisis. Because while these are extraordinary times, we're very lucky that California already has social insurance programs and employment protections that can protect workers dealing with COVID-19. So the 4 biggest programs that workers need to be aware of are paid sick days, unemployment insurance, state disability insurance, and paid family leave. The first one is paid sick days. So if you or a family member is sick or needs preventative care related to COVID-19, including when public authorities recommend quarantine or self-isolation, workers may use any accrued paid sick leave for those reasons. Under California law, every worker is entitled to at least 3 paid sick days each year. However, local jurisdictions have laws that provide for more days. So, example, in Oakland, you're entitled to 5 days if your employer has 10 or less employees, or 9 days if your employer has more than 10 employees. San Francisco and Emeryville also have similar laws. Additionally, there are a lot of changes happening at the federal level. So I will give you the most up-to-date information I have, but this could change tomorrow, the next day. But right now, starting April 2nd, under the Families First Coronavirus Response Act, as long as your employer has fewer than 500 employees, you are going to be able to access 2 weeks of additional paid sick days starting April 2nd. Is that good? Okay. Paid sick days are paid directly by your employer. So as long as you have an employer, your employer has to provide those. The next and the big one that I think most people are going to be looking for right now is unemployment insurance. So if you are out of work or underemployed, which means your hours have been cut through no fault of your own, and you have enough past wages, and you are able and available and willing to work, you can receive unemployment insurance. So right now, benefits range from $50 to $450 per week, and you can receive unemployment insurance for up to 26 weeks. However, there is pending federal legislation that is most likely going to change this, and it's expected that the federal program will hopefully be signed Friday or shortly thereafter. So some changes you should be aware of that are probably coming down the pipeline is that there's going to be an increase in weekly benefits such that each worker will get an additional $600 per week. There also will be an additional 13 weeks of benefits, totaling 39 weeks that you can receive unemployment insurance. And there's a separate fund that will be created to allow for unemployment insurance for independent contractors and self-employed individuals who usually are ineligible for unemployment insurance.
Ooh, say that one more time.
Yes, so under the proposed federal legislation, which has been passed by the Senate and is expected to be voted on by the House tomorrow and signed, hopefully, there is going to be a separate fund created where if you do not usually qualify for unemployment insurance because you are an independent contractor, a gig worker, a self-employed, you will have access to unemployment insurance. So I encourage you to keep checking Legal Aid at Work's website, and also the National Employment Law Project is a national organization that is really on top of the UI changes and have great resources. So the one thing about unemployment insurance that's really important, though, is you can only get unemployment insurance if you have an employment authorization document or are a permanent resident. So if you're not a citizen, you do have to have proper work authorization to get unemployment insurance benefits. And that is unfortunate, and right now there's not changes to that at the federal level. So unemployment insurance is administered by the Employment Development Department. You can apply by phone, by mail, fax, or online at edd.ca.gov. I strongly encourage you, if possible to apply online. It will extremely expedite the process of processing your application. But as Mayor Schaaf mentioned at the beginning, it is unprecedented times, and the EDD is getting a lot of applications. So prior to all this, they usually recommended that you would not receive UI benefits for 21 days. I imagine that's going to be a little bit longer, but rest assured that EDD is doing everything they can to try to process these claims as fast as possible. So 2 other programs that may be available and are important that a lot of people don't know about is state disability insurance and paid family leave. California is one of a handful of places across the United States that actually has these programs. They're entirely employee funded. You pay into it out of your paycheck. So if you're getting paid on a paycheck, there's a deduction that comes out that goes into this fund. You can verify whether you pay in by looking at your pay stub, and if you see CASDI, that means you pay in and are eligible. So what can you use these for? So you can use these benefits if you're taking time off work to either care for your own disability or to care for a family member who has a serious health condition. Both state disability insurance and paid family provide you with 60 or 70% of your normal weekly wages. So it's 60% for everyone, 70% for the lowest income earners. So if you're unable to work due to having or being exposed to COVID-19, you should apply for state disability insurance. It's currently, this might change, it's a higher wage replacement than unemployment insurance, and you can get it for up to 52 weeks. Now, if you're unable to work because you're caring for a family member who has COVID-19 or who has been exposed and been instructed to self-quarantine, you can collect paid family leave. It's the same wage replacement benefit amount, that's 60 or 70%, but you can only get it for 6 weeks. That is gonna go up to 8 weeks starting July 1st. And family members under that include parents, parents-in-law, siblings, grandparents, grandchildren, spouses, and registered domestic partners. I should say both state disability insurance and paid family leave do require a medical certification. So you will have to have a doctor certify your need for those benefits. However, the EDD is allowing telehealth. So if a doctor can see you virtually, they still are able to certify for you. You also can qualify for state disability insurance or paid family leave if you've recently been terminated, laid off, or quit, because they're completely disconnected from your employer. So as long as you have been employed within the last 3 months, you still are eligible for these benefits. Like unemployment insurance, the Employment Development Department also administers state disability insurance and paid family leave. You can apply online or by paper application. Again, I strongly encourage to do it online. Unfortunately, the online application is only in English. You can order a Spanish version online that will be mailed to you, and you can do a paper application. For all other languages, you do have to either get assistance or you can call, they have language access lines. In many languages, go to their website, you can get the number, and someone can help you fill that out over the phone. So similar to unemployment insurance, generally independent contractors or gig workers don't qualify for paid family leave or state disability insurance because you have to be an employee to pay into it. However, many individuals within California whose employers have labeled them independent contractors are not actually independent contractors under California law. California law makes it very clear that many of these people are misclassified and are actually employees. So if you believe that you've been misclassified, you should apply for unemployment insurance, state disability insurance, and paid family leave. While you may be initially denied, the EDD has a process for you to challenge your misclassification. They will then make a determination. If they find that you have been misclassified, you are eligible for benefits, and that is really important. Particularly, I would say if you have any doubt, apply. Also, just be aware that also under the Families First Coronavirus Response Act, there was extended job-protected paid leave to care for a child whose school or childcare is closed, which I know a lot of workers are dealing with right now. So starting April 2nd, if your employer has fewer than 500 employees, your employer is required to provide you to up to 12 weeks of paid leave to care for your child. It's at 2/3 of your normal pay rate, up to $200 per day. If you work for an employer with less than 50 employees, they may be able to seek an exemption. So there are other laws that may provide unpaid job-protected time during this, but I want to just pause and turn to some actual questions that came up. But I encourage everyone to please go to our website, legalaid@work.org. You can learn about all your employment rights. You can see all our helplines, and you can even schedule an appointment with our Workers' Rights Clinic if you want individual information. So I was looking through all the questions that were submitted by residents, and there was a lot of questions around what is available for people who get paid on a 1099, usually referred to independent contractors and gig workers. So I just want to make this really clear because I touched on it a bit, but a lot of these workers under California law are actually employees. I'm sure some of you have seen there's been several lawsuits regarding Lyft and Uber and DoorDash drivers challenging their classification in the courts right now. So if you find yourself as one of these individuals, I encourage you to apply for unemployment insurance if that applies to you, or state disability insurance or paid family leave. You will most likely have to present to the EDD proof of your wages and how long you've been working, so try to keep copies of those and be ready to answer some questions related to that. Additionally, as I mentioned before, the current federal package, which is expected to be signed in the next few days, creates a new program called Pandemic Unemployment Assistance that will capture people who are not generally eligible for UI benefits, including independent contractors and gig workers. So I am optimistic that there will be some relief for this category. So apply now, because even if they find that you aren't misclassified, if this goes through, you will then be able to access these other PUA benefits, they're being called. Another question that came up was around, shouldn't essential workers like grocery store employees be wearing masks to protect themselves since they are so exposed to the public? So, things are changing rapidly, and I'll say at the moment, neither the state nor federal government have issued any additional directives regarding health and safety standards for employees in these new kind of labeled essential functions. But all OSHA requirements still apply, which means employers have a duty to provide all employees with a safe and healthy work environment. And OSHA also has strong anti-retaliation provisions, meaning it is illegal for your employer to treat you worse or take any adverse action against you because you complain or ask about health or safety standards. And so finally, the last question I'll address is, what is available for immigrant workers, including undocumented workers? So I want it to be clear that undocumented workers are protected under all of California's wage and hour, anti-discrimination and retaliation, and family and medical leave laws. You have every right to be free from discrimination, you have your right to pay as an undocumented worker. Additionally, as I stated before, undocumented workers can also receive state disability insurance and paid family leave, as long as you have been getting paid on a paycheck and that deduction has come out of your paycheck, you are eligible. So the only ones that are excluded are individuals that are being paid in cash or personal check and aren't subject to the payroll tax. But undocumented workers are not eligible for unemployment insurance, but many private funds have started popping up to provide some relief for these workers, and Legal Aid at Work is currently populating a list of that, and we hope to have that on our website as soon as possible. So thank you so much.
Oh, Jenna, thank you so much. That was all really helpful information. And if there was one theme, it's like, when in doubt, apply for the benefit. Whatever you are, whatever your income situation is, when in doubt, apply, because everything's changing. It might be extremely different tomorrow, and all sorts of benefits are going to be available that have not been in the past. So get your application in now, because they are definitely overloaded, and what a great resource that people can actually call and get one-on-one counseling with your lawyers and your legal experts. Next, we are going to hear from Shanae Franklin Minor. Shanae is a fabulous member of the City of Oakland team. She runs our rent adjustment program, and Shanae can talk about what kind of protections that tenants in Oakland have. Questions, you might have had questions also from landlords, as well as give people a little bit of a preview of what we fully expect the Oakland City Council to adopt tomorrow night. Shanae, thanks for being here.
Thank you so much, Mayor.
And talk close to your microphone. It's loud in here, but it's quiet online.
Good evening. My name's Shanae Franklin Minor, and I'm the program manager of the Rent Adjustment Program in the Department of Housing and Community Development. I want to let everyone know that we are open for for call-in counseling. We have housing counselors available 9 to 4:30, Monday through Friday, to answer any questions that come up concerning landlord-tenant issues. I know this is a really confusing time for folks, and we're here to answer those questions and help you navigate some of the changing laws and the existing crisis. The main theme that we've heard over the last week from our clients and from the folks who sent questions in tonight is Oakland going to pass a eviction moratorium? And tomorrow, the City Council is going to consider passing a moratorium, and it is one of the most protective in the local area. The moratorium is going to cover not only residential tenancies, but commercial tenancies as well. Small businesses with with employees of about 100 or less. Additionally, all evictions will have a moratorium. So not just evictions that are related to non-payment of rent, but all evictions, there will be a moratorium for where a property owner cannot serve a notice during this local emergency. Additionally, the evictions related to the local emergency, if someone can claim that they are unable to pay rent because of lost wages during this time, because they have to care for their children, that type of claim will be a complete defense to an eviction under the moratorium that is being presented to council tomorrow. So what that means is that it is a complete defense. You will not be evicted if you can't pay your rent during this time. That doesn't mean that the debt is completely canceled, however. What is presented by the council tomorrow, what they'll be voting on, is that while a tenant cannot be evicted for non-payment of rent, they will still owe a debt that a property owner would be able to go after them in small claims court. So it is really important distinction, but the primary concern of the council has been to make sure that people are not unhoused. So that is a distinction that is different than some of the other jurisdictions that we see in the county. Additionally, for late fees, property owners can't have late fees during this time, so there is a moratorium on late fees for non-payment of rent. There's also a moratorium, a complete moratorium, as I said, for people who own who have businesses. The other question that we've seen that is on people's minds is, how am I going to pay my rent? Will there be any rental assistance? And so the Housing Department currently is looking to work with philanthropic partners to try to figure out how we can create some type of a rental assistance program. Also, tenants can contact Keep Oakland Housed. They have some services available as well.
And an easy way to get that is call 211.
Right, thank you. 211
or the website.
And also keepoaklandhoused.org. Another consideration and what the Rent Adjustment Program is working on now is trying to create a template letter. We really encourage tenants to communicate with their property owners if they're unable to pay their rent, to try to work out some type of a payment plan. And we're working on a template letter to help create and facilitate that conversation as well. And we're also looking at potential regulations that might put some type of a grace period involved with the rent moratorium. The city is very, very concerned and really hears and understands that people are fearful of being evicted. And so that's why we're going to take some pretty strong, the council is looking to take some really strong measures to prevent that from happening and keep people in their homes during this time.
All right.
Yeah.
Well, thank you. That was very helpful, Shanae, and thank you for all the great work you do leading that department every day. So you heard it here that the Housing Assistance Center in the city of Oakland is open, but taking phone calls. But you can get advice on housing during this time by calling the Oakland Housing Assistance Center. Shanae, what's the number? I know it's 510-238.
It's 238-3721.
All right.
And our housing counselors are available. I also wanted to give the phone number for the Eviction Defense Center, they're a nonprofit provider who are open for drop-in folks, even though there will potentially be a moratorium on evictions. That doesn't mean that a property owner might not still attempt to serve a notice. And the Eviction Defense Center is open to help folks who are actually who have been served with a notice of eviction. I also wanted to point out that the sheriff's office and the courts are closed. So the sheriff has actually said that they have a moratorium on lockouts. And what happens if you were evicted previously and you went through the eviction process and received a sheriff's notice, the sheriff right now will not be locking folks out. However, when this local emergency is over, you really are going to have to act fast. So it's not a time to kind of sit and not think about what the next moves are, but understand that you are not going to be locked out of your house right now. There is a moratorium on that, as well as the courts have a moratorium on filing for evictions. So no evictions can be filed at the courthouse. That doesn't mean that a property owner might not serve you. So if you get served, go to the Eviction Defense Center and they will help you strategize and figure out what to do next.
All right. Well, thank you, Shanae, and of course to everybody in the public. Please spread the word, particularly amongst groups that are often discriminated against in housing, non-English speakers, people of color. It is very important that this information get out to those who need it most, because just because we pass a law, it doesn't mean everybody is going to find out about it. So please spread the word. Next up, Daryl Dunstan has been leading our city's response to homelessness. He is also playing a leadership role within our Emergency Operations Center around shelter. So Daryl, I know a lot of people are concerned about our unsheltered residents. What is the city doing to help them and get through this crisis, and not only help protect the health of these incredibly vulnerable people, but also hopefully benefit from what we're doing now to address homelessness for the long term?
Thank you, Mayor. First and foremost, if you are seeking housing, seeking shelter, or you know someone who is seeking housing or shelter, please call 211. Again, if you or someone you know are seeking shelter, please call 211. As the mayor stated, my name's Daryl Dunstan, and I am the staff person in the city administrator's office that focuses on homelessness. And currently my role is I am a unit leader with our Emergency Operations Command Center, which is a part of the standardized emergency management system, The reason that local jurisdictions activate their SIM structure is so that we can communicate and coordinate with the county and the state jurisdictions in a time of crisis. And that is what the City of Oakland has done. We activated our Emergency Operations Center the week of March 9th, and we have been fully operational since then. And some of the things that we are focusing on is the city's response to the COVID-19 crisis as it relates to our unsheltered population. So what has the City of Oakland done thus far? We have doubled our health and hygiene interventions within our encampments, and what that means is that we've increased our portable toilets, our wash stations, and our garbage collection service, and we're offering that service to over 40 encampments at this time. We partner with the county to be able to isolate our unsheltered folks who may either have contracted COVID-19 or have been exposed to it. And as the mayor stated, one of those hotels is currently operational. There is a referral process, and we are asking folks to visit Alameda County's Healthcare for the Homeless website, which is achch.org. If you are seeking information about how to access services at the hotels. I've got a few questions here that I'm going to address, and I look forward to addressing more questions as we get further along into this town hall. But the first question, as the mayor stated, is what is being done about homelessness in the city of Oakland as we tackle this deadly virus? And so in addition to those health and hygiene interventions that I've mentioned, we've also accepted 91 trailers from the state to be able to offer isolation spaces to our unsheltered folks, again, who have been exposed to COVID-19 or who are symptomatic. And we hope to have those 91 trailers operational within the coming weeks. We also have received emergency funding from the state of California. The city of Oakland got a direct city allocation, and staff is working diligently to execute that agreement and also to be able to execute contracts with service providers so we can expand the services that we are already providing to our unsheltered population. Another question that's being asked is, will homeless camps be provided water, paper towels, porta potties, so that they can follow the CDC sanitation guidelines? And again, that answer is yes, and we've expanded our health and hygiene services. And in addition to that, we utilize our outreach teams, which is managed by Roots Health Clinic and Operation Dignity. And they are really still on the front lines, engaging folks, seeking their needs, trying to understand how can we better serve them. They are distributing personal hand sanitizers. They are distributing harm reduction kits. They are distributing COVID-19 informational materials so people understand what safety precautions they should be taking, and as far as social distancing, as far as washing their hands, and making sure that they are as informed as they can be. Another question that continues to be raised is testing for our unsheltered individuals, and that we, again, are partnering with Alameda County's Healthcare for the Homeless Agency, who are working diligently to stand up testing sites to be able to provide that service to the unsheltered population. But I am happy to report that 2 of our service providers within Oakland are providing testing. That's Roots Community Health Center, and that's Lifelong Medical. And again, if you are seeking those services, it's best to visit achch.org, which is Alameda County's Healthcare for the Homeless website. And again, testing is only being provided to folks who are symptomatic or who have known to be exposed to somebody who has tested positive. And so, again, I encourage you, if you are seeking those services, to visit Alameda County's Healthcare for the Homeless website to be pointed in the right direction. Another question that was asked is it true that Governor Newsom rented the Radisson Hotel and the Comfort Inn on Eads Avenue in East Oakland as isolation sites to house the homeless? Yes, that is true that the state leased those 2 hotels. However, they leased those hotels with the intention to transfer the lease over to Alameda County. And my understanding is those negotiations are still underway if they haven't been executed already. And as I stated, one of those hotels is operational. They are accepting referrals right now. That is the Comfort Inn and Suites on Eads Avenue.
But don't show up there.
No, do not show up there.
You've got to be referred.
Exactly. And the mayor is absolutely right. Do not show up at the Comfort Inn and Suites seeking a bed. Again, it is a referral process, and you have to follow those steps, follow those protocols if you are seeking services there. And again, the best way to access those services is to visit achch.org, and you can be pointed in the right direction. So with that said...
Or to call 211.
Or to call 211, that is correct. So with that said, Mayor?
All right, thank you, Daryl. Thank you for everything that you're doing. Again, one of our incredible City of Oakland workers who is just working overtime. And, you know, I got off a call. We had a call today with all of our homeless providers in Oakland. And what an inspirational call. These are shelters that sometimes were only open during the day or limited hours.
Yes.
They're now 24/7. Just everybody is showing up in a way that is so beautiful.
Yeah,
in
Mayor,
Oakland.
to that point, yes, people are answering the call to action, and I echo your sentiments on that call. It was heartwarming to know not only how much they care, but how committed they are to serving the unsheltered population.
Yeah. Well, thank you. You have not disappointed us. We are getting lots of questions on our different social media streams, so we're going to start answering some of the questions that have come in over the last hour. And to do that, I'm going to turn it back over to Alameda County's Health Officer, Dr. Erica Pon. Thank you, Dr. Pon.
Sure, thank you very much. So this is a question on Zoom, and should I say the name of the person too? Okay. So the submitter was Kimberly Stitz, and the question is, what do you advise for a parent who wants to pick up their child and have them go to their grandparents who live in another city? What do you recommend? So I am glad you asked this question because there is a section in the health officer order, and I know it's sort of long and detailed, but we tried to cover a lot of bases, and we definitely want to allow for, you know, when people do need help with their child care, especially essential service workers or essential businesses, to be able to have their child cared for by someone else. So. And especially this is very limited, so it is okay to do that, to bring your child, for dependent care in general actually is okay under our order. So if you need to bring your children to your parents or you need someone else to come help care for your parents, that is okay under this order. Again, we really want to limit as much as possible, but we also understand that part of sort of just getting by and doing the minimum is being able to take care of each other. So that's one question. Another one here is from someone with the initials TJ, also on Zoom. And the question is, without violating HIPAA requirements, how can we encourage agencies, hospitals, and companies to inform staff when someone tests positive? So this is also a great question, and I'd like to sort of explain how this generally works from a public health perspective and also how we work with human resources in different organizations. So whenever we find out about a case of any reportable communicable disease, including COVID-19, what we do is we work with that person and the individual to first interview them. And of course, the most important people who are at highest risk as far as contacts are people who they live with or intimate partners. And then we will also be interviewing about when they were symptomatic and when or for another disease, when we think they might have been infectious to others. And we always have special criteria that we share on who might be considered a close contact. So we do that, and then we work closely with a company, for example, to investigate that and try to ensure that people who were exposed, that we're concerned about the exposure, do get notified. And we also work closely with the companies to try to do that in a way, if possible, to not disclose who the person is. And obviously, sometimes that's easier than others. If there was an exposure in a meeting, for example, we can just work with the HR and the company to say, someone in this meeting had this and you may have been exposed. But we do that very carefully. So the bottom line on that is no news is generally good news, because we do try really hard to work with all these organizations to make sure that those notifications happen for people who might have been at risk. So that is why you don't always hear about it. And let's see, one last one was TJ the question is, does having an O blood type exclude one from being susceptible to the virus? So as far as I know, that blood type has no association with being susceptible, but I think there's many new things to learn about this virus. We're learning more every day, but I've not heard anything about blood type being associated with it. So thank you.
Thank you, Dr. Pon. And now we've got some questions. More questions have come in about benefits. People who need to replace their income. So Jenna, please answer some of the questions we've gotten live.
Yeah, okay, so the first question is from Facebook, from Susanna Zararte. And she asks, what are the plans to support house cleaners who get paid in cash and are out of work during these moments? So I had mentioned earlier that unfortunately, if you're getting paid in cash or undocumented, you don't normally qualify for unemployment insurance or paid family or state disability insurance. So as I said, there is a private organizations that have been setting up relief funds for these type of workers. So some that I want to point out. So first, there's the Oakland Food Service Workers COVID-19 Relief Fund. And so this is available to food service workers living or working in Oakland who are impacted by COVID-19 crisis and shutdowns. That's a very local one. Some other big ones are through the Restaurant Opportunity Centers United, which is providing restaurant workers in need of financial assistance. There's also the National Domestic Workers Alliance Coronavirus Care Fund for all domestic workers. And there's also the National Day Labor Organizing Network for Immigrant Worker Safety Net Fund.
And Jenna, this sounds like something that Oakland should look at carefully for our COVID-19 relief fund. It sounds like a huge need. I actually just got handed one other. I'm going to just put it in here. Do parents with children whose schools are closed and don't have access to childcare need to apply for unemployment insurance benefits? And that came off of YouTube.
Yeah, so right now for those situations, you can use paid sick days. And the federal law that goes into effect April 2nd will also mandate that your employer must provide you with pay. The first 10 days is through the paid sick days proposal, and then the additional time up to 12 weeks is through another section, and that will provide you with 2/3 of your pay. But if you don't have paid sick days or you've used them all, then yes, you should apply for unemployment insurance, and that will be a qualifying reason at this time.
And Jenna, do you have to use up all your sick leave before you can apply for unemployment?
Not necessarily, but I would advise you to, because paid sick, you're going to get more money. Basically, right now, unemployment insurance are $50 to $450 a week, and so most likely you're going to get more benefits through paid sick days. Of course, that might change given what happens at the federal level, but I would advise, if available, to first use paid sick days.
Right, and I also want to put out a shout out for Bay Area Tip Jar. There is a virtual Bay Area Tip Jar where everybody can support restaurant workers from your favorite local restaurants. In fact, I saw a couple folks from Calavera, one of my favorite eateries in Uptown, registered. And if you are a restaurant worker, you can register at Bay Area Virtual Tip Jar. It's all online, and it's one way that we can all, on a very personal level, support people that are out of work in the restaurant industry. Jen, I know you have some more questions, right?
Yeah, and I just also want to mention, besides, I think it'd be a great priority for Oakland to take this up to deal with this, but also there is we are part of many worker advocates that are calling on the governor and state legislature to also take similar measures. So the next question comes from Twitter, and it's, what do I do if I'm at the end of my unemployment? So as I mentioned earlier, there is a federal proposal right now that is going to extend unemployment insurance benefits for an additional 13 weeks. So I would say watch that measure. It should be voted on by the House tomorrow and hopefully signed by the president shortly thereafter. And so hopefully you will get an additional 13 weeks. There was another one from Facebook. It says, if you are self-employed, a freelancer, should you put in a regular UI application now or wait for the new form? I would suggest putting an application now and do not wait. Put it in as soon as possible. We had another one from Zoom that asked, for paid sick days, how many days can workers use any accrued sick days due to the quarantine? If so, how many? And then it asked for the difference between California and Oakland laws. So As I stated, under California, your employer has to provide you with at least 3, but if you work in Oakland or San Francisco, their laws are the same. Your employer has to allow you to use at least 5 paid sick days each year if they have 10 or less employees. If they have more than 10 employees, you're entitled to 9. I will say, under state law right now, your employer can require a doctor's note if you use more than 3 consecutive days in a row. San Francisco's Office of Labor Standards Enforcement just put out guidance that they are waiving the doctor's note requirement during this time, and so I would encourage Oakland to do the same to make sure that we aren't forcing people to go into doctors right now. But you should be able to use it as long as you have a qualifying reason to use it. Use as many days as you have accrued and are allowed. Another one from Zoom is, if staff is laid off temporarily, does sick leave apply? So this is somewhat complicated and will depend on what status they're actually in, if they're laid off, furloughed, put out on leave. If they still are on your payroll, then you do have to provide paid sick days. If they are actually laid off, then maybe not. But this is changing really quickly, and this is something that's being looked at on the state and federal level. So right now, I would just say hold on and check back for more information.
Great. Thank you, Jenna. That was all very, very helpful. Next, we've gotten some more questions in about tenant rights and what renters should be doing. So back to Shanae Franklin Minor. Shanae.
Thanks again. So one question we still keep getting asked is, are Oakland renters under protection from evictions? And so the answer is tomorrow. The City Council at 11 o'clock through a public meeting, a virtual public meeting. Please go to the city's website to find out how you can participate. There will be a meeting to vote on a moratorium for evictions in Oakland.
Shanae, I know the City Council well enough. It's going to pass. Just assume it's going to pass tomorrow. I have a good feeling about it.
So it will pass tomorrow. We're going to have a moratorium on evictions tomorrow. So chime in. The meeting is 11 o'clock. The evictions, it will be all evictions. So it's different than, it is more protective, is most protective in the state. All evictions, there will be a moratorium. And that is in line with what the courts are doing. The Alameda County courts are saying that there is a moratorium on eviction filings. So all filings, no filings can be had currently in the courts, and no evictions in Oakland. Additionally, if you are feeling insecure because you can't pay your rent due to lost wages because of the current local emergency, that will be a complete defense to an eviction. So that means that you will not be evicted for non-payment of rent cases in this local emergency or after. That does not mean that the debt is wiped out. It's slightly different. You will be liable for rent in small claims court, perhaps. A property owner will be able to come at small claims court. And what we really encourage is that property owners and tenants work together during this crisis. Work together to figure out a way to create a payment plan or some type of way so that the property owner can get paid and the tenant is not financially burdened. That being said, Oakland will pass an eviction moratorium, and you cannot be evicted, you cannot lose your housing because of this crisis.
And Shanae, it's important to again note that most mortgages are going to have a 3-month holiday. So that should help landlords buy some time to work things out with their tenants, right?
Exactly. And thank you, Mayor. That was one of the questions that came up from a property owner, from Dan, I think it was from Jonathan Bornstein. He said, are my tenants going to be allowed to not pay rent? What is there going to be for landlords? And so to answer the second question, there will be, for most mortgage companies are forgiving for the next 90 days mortgage payments. So that is time to work with tenants, figure out, how you'll be a payment plan or some type of way to get everyone's needs met at this time. Additionally, just to be very clear to Mr. Bornstein and every property owner out there, tenants are not relieved from the obligation to pay rent. That is not what this means. They do have that obligation, they just can't be evicted for it. So just be very, very clear, you can get the money, it's in small claims court, and if you have further questions about this law, about the moratorium, about navigating through the Alameda County court system, please call our housing counselors. They are here to help both property owners and tenants navigate this system, and we also offer mediation programs that can help folks to negotiate the conflict and try to figure it out. And we're hoping to have those mediations functioning online in the next few weeks.
Give your phone number again.
Our phone number is 510-238-3721. But if I'm incorrect, I will correct myself in a little bit. We also have a question from Don. What protections are there for people whose rent increases or lease ends during this time? So one thing I forgot to mention is that in the moratorium, there's also a moratorium on rent increases. So rent increases above the CPI. So the regular CPI, those increases can still go into effect. However, any rent increase that is served at this time or that was served previously and becomes into effect during this local emergency, any increase that is for capital improvement or anything that is above the CPI, there will be a moratorium on those type of rent increases. And this is the most protective in the state. No other city has a moratorium on rent increases. Lease ending. If your lease ends during this time, during this local emergency or any time, a lease ending is not an eviction. You do not have to move because your lease ends. Your lease automatically becomes month to month. So any questions, just like this, on lease ending, lease breaking, anything, please call our office. We have housing counselors available to answer these questions and help you navigate the complex laws. Thank you.
Great, thank you, Shanae. And then we're going to go back to Alexandria McBride, our Chief Resilience Officer, to answer some other questions that have come on through our social media platforms. Thank you, Alex.
Thanks. So I have a question from Bobby from Twitter. What are the requirements for disinfecting bikes for bike share programs? Our Department of Transportation has already received the enhanced cleaning plans that the shared mobility companies have shared. We do still advise, though, for anyone who to use that equipment to please use hand sanitizer and please refer to the health guidelines on how to appropriately wash your hands after use. And also thanks to Warren Logan at Department of Transportation who answered my quick text when I saw that question.
He's in the mayor's office.
I'm sorry, yeah, he's in the mayor's office. Sorry, Warren, I knew that.
You can't have him.
Are bike shops essential businesses? This is a really great question. Several cities have declared bike shops as essential businesses. I'm not sure if Oakland is one of them yet. So, at least according to my...
Are bike shops essential services? Yes.
Okay, great, thank you. Okay, cool, so I was looking at a kind of older source. So that is indeed a essential business, thank you.
Bike shops are essential businesses.
That's from PSP TV. And then there's a question about what has been the impact of crime and policing in Oakland. So our EOC, or Emergency Operations Center, includes regular updates from our first responders. We have not heard, at least in the an update we heard a couple of days ago, we had not seen a spike, so it's been pretty balanced, but we are keeping an eye on that and are discussing that, effects to all of our system every day in our EOC. And
also, thanks to getting that testing center up, we're keeping our officers healthy.
That is an important part. So we, understandably, there may be impacts to staffing, and we're preparing for that, but we're happy to have that site for that service. Businesses, this is from Zoom. For nonprofit agencies currently looking to partner with Alameda County, how do we go about expanding our services to assist? Excellent question. I think there are a few ways to answer that question. 211 has been a great resource for the county just to sort of share and interact and ask for resources. We also, as I mentioned earlier, are really trying to be as proactive as possible in sharing and letting folks know when we have needs or or need volunteers. We're still working out that structure to be as seamless as possible, but I think at this point, 211, referring to our City of Oakland website, and those will be the first steps. And also our COVID relief fund, the oaklandfund.org is the address to the COVID-19 relief fund that we've been talking about, and that has some good information on how the fund is being used and potential ways to partner. And that question was from Zoom. And then from YouTube, can cashiers at grocery stores be prioritized for protective gear? That is an excellent question and a note that I will take back to our EOC. This is Emergency Operations Center. It's needs like this that we're trying to capture because we do hear so much from generous Oaklanders who want to give us supplies. And once we're able to fill that need for our first responders, we're also trying to get as much input from other partners, whether that's hospitals or potential, employees of grocery stores, figuring out how to distribute potential excess supplies. So thank you for that note, and we will add this to our EOC system as a extra population to think of.
Great, thank you, Alex.
Yep.
It seems like we've gotten some additional questions about how we're working with our unsheltered. So I'm going to turn it back over to Daryl Dunstan.
Thank you, Mayor. So we did receive one question from Yuri on Facebook, and he asks, how can houseless people access the internet? Is there another way for people to get access? And that is an excellent question. Typically, we encourage our unsheltered folks to visit our housing resource centers and our libraries. Obviously, they are not open to the public at this time. And so staff is exploring ways to possibly increase the number of cell phones that we're able to provide because we do understand that folks who typically access the internet through other means aren't able to access them during this crisis. And so while we don't have a definitive answer at this time, it is something that is on our radar. It is something that we understand is a tremendous need, and it is something that we hope to address in the coming weeks.
Great. All right, thank you. And now we're going to have some questions again about health for Dr. Pond. Dr. Pond, I know you have been working night and day, so thank you for being with us here at 7:35 at night answering questions from Oaklanders. Thank you.
Sure, no problem. Happy to be here. So this is from Facebook. Jean Boomer is asking, this is an excellent question. My 96-year-old mother lives in Oakland in an independent living community with 125 residents based on the facility's recommendation. I have not visited my mom since February 28th, and they have required the residents to stay in their rooms full time. 2 questions. 1, I think the facility is safer than my own home. Am I correct? And the second question is, should this entire community be tested for COVID-19? How can we make this happen? So 2 excellent questions. So, and as you are alluding to, but just to be really explicit with everyone else, so an independent living community like this that is largely the elderly is certainly one of our highest risk communities, both because of the age of the people in the community and because they're in a congregate living facility. So this particular facility was very proactive, which is actually great. And again, just like all the social distancing that the rest of us are living with now, this is a huge restriction on them, but is absolutely to protect the community there. And so, yes, I would agree that the facility is currently safer than your own home. And then should the entire community be tested? So again, the recommendations really are for testing people who have symptoms, and I'm sure, and we've been updating lots of guidance for long-term care facilities, including restricting visitors and doing exactly these measures. And we are jumping on top of it with, and as are the facilities that we've been working with, to test people when they have symptoms and to make sure they're completely isolated from others. Some of you may have heard about outbreaks in other places. Certainly Seattle's first long-term care facility outbreak led to several deaths, and it was extremely tragic. So we are trying to be incredibly aggressive here in Alameda County as well. So I do think it's a great question and good for people to know. And again, I know it's hard not to visit loved ones, but thank goodness in this day and age we have things like virtual town halls and FaceTime and Zoom, and so you can at least keep in touch that way, but I know it's hard. Another Zoom question about hygiene. Do we need to disinfect foods when it's brought in from the grocery store? So, I do think for fruits, I would highly recommend washing fruits and produce always. I think not only could there potentially be any virus or bacteria from other people touching it, and then, especially other produce, we know again about rare contaminations with other bacteria. So I wouldn't do above and beyond what you would normally do, but, and I think especially with sort of fresh produce and vegetables and things like that. Otherwise, I wouldn't recommend or worrying about disinfecting other things. I think the more important thing, again, is to remember to wash your hands well before you're cooking and preparing food, and washing your hands before you eat. And again, really trying, which is really hard for all of us, I know, but really trying to avoid touching your face, because that's, again, when you might, if you rub your eyes or your nose or your mouth, that's when you could have some kind of germ or bacteria in what we call your mucous membranes and potentially infect you. And then the last question I will answer, which is also a good one, is from YouTube about testing. Are there plans to start testing for antibody markers to identify those who might be more safely deployed for delivering essential services? So, outstanding question. So there are tests for other diseases out there for sure that look at antibodies, and there's two kinds of antibodies. Sometimes there's one we call IgM that looks generally at more what we call acute infection, meaning you have an infection now or recently, and there's another kind of antibody that usually detects once you've become immune. There are these tests evolving, and I haven't read up on all the latest data because it's hard to keep up on all of the information, but my current understanding is there are definitely still some, there's one that's approved, but even that one, I think it's a little bit unclear how to interpret it clinically. Some other examples of this for other diseases are that you have to check people once 1 or 2 weeks after they have the infection, and then a few weeks after that to determine if they've been immune. And there's a lot of false positives with this other antibody that's an IgM for all kinds of diseases. So I think it's really early to really be trying to do anything strategic. I think some actual clinical studies need to be done first before widely making that available, because I think those of us who are frontline clinicians really want to know what it means when we get that test. So, and I just want to say a moment about that too. I think there's a lot of great innovation going on with testing, but I think just like a lot of other unfortunate things in this pandemic, in this scenario, there are some scams out there too. So I think we in the healthcare community are trying to be really cautious about what we're evaluating, making sure things are actually approved. And I think even the FDA is trying to balance allowing for innovation and speed so that we can get more testing out there. But I think we always want to make sure we balance that with accuracy and reliability as well. So that's something, again, that at all levels people are trying to do, but just to be cautious and make sure you're using reliable information and reliable labs, and checking with people who can really try to verify a test.
No, thank you, Dr. Pon. Yeah, we've experienced that a little bit too. People trying to sell us $6 masks that normally cost 50 cents. So I did get one more late-breaking question off of Zoom from Quebec. You referred to this earlier, but I'm sure people who've tuned in now want to hear it again. Are there plans to extend shelter in place?
Yes, I know that it's everybody's burning question. We are actively talking. In fact, I was looking at some email trails just now in between, and we are actively talking, those of us, the 7 health officers who did the original decision, and this time we will also be, coordinating closely with our other surrounding partners around this decision. And, we're talking actively in the next few days. We hope to make some decisions in the next week and be able to communicate that more next week. But it is very early again, so we're going to make tough decisions with little information yet again. But we are working on that, so we'll be able to give more information next week. I did say earlier, so I'll just say it again. I can say, as far as setting expectations, I don't see a scenario where suddenly everything goes back to normal on April 7th. I think there are different scenarios that we're talking through, but I don't think it'll just be, let's just go back to normal, because we know that we've definitely, we're hoping to have impacted the rate of increase, but I think based on what we've seen in China and all these other countries, even with dramatic measures, it's not going to suddenly peak with just in 3 weeks. So more to come, but stay tuned.
And just to remind people, the current shelter in place is in place till April 7th, but that's actively under review. But the school closures was extended this week until May 4th, if I'm not mistaken.
Through May 1st, which is a Friday. So then some different schools sort of interpreted, or different districts, I think, okay. Yes.
All right, through May 1st, through May Day.
And then I should mention too, there's the state order. So the state health officer and the governor also issued a shelter-at-home order a few days after we did in the Bay Area, and that one doesn't have an end date. So we are actually more restrictive in some areas, especially related to essential businesses here in the Bay Area. And so we are, again, making some decisions about the Bay Area, and we'll certainly be communicating closely with our state partners. But even if we, for example, lifted our April 7th, the governor's order and the state health officer is still in place until a time TBD.
Okay. Well, thank you for clarifying that and for setting realistic expectations. All right, we've had some more questions come in about worker rights and worker benefits. Back to Jenna.
Thank you. Okay, so there was a question from Twitter that said, is the EDD requiring a W-2 form for self-employed workers? Is there a way to bypass this? I'm not entirely clear, but I think what this is asking is if I'm self-employed and therefore don't have a W-2, how can I apply for unemployment insurance? And so that is fine. You, of course, will not have a W-2 because you're either self-employed or been misclassified. So what the EDD has told us, if you are applying for unemployment insurance, state disability insurance, or paid family leave, and you are not a classic employee but believe you've been misclassified and should be entitled to these benefits, it's very helpful if with your claim you provide your employer name, the phone number, the address, and their physical location, the type of work you did, the dates you worked, and the gross wages paid and how it was paid, whether it was hourly or weekly. Then if an additional wage information is needed, so any other proof of wages like a check stub, W-2, or maybe payroll info if you are self-employed, the EDD staff will request that documentation. But if you provide that up front with your application, it will make it go faster. So to the extent you can provide any of the information I just said along with proof of wages, it will help expedite your claim. We also had one from YouTube, then again, is just asking about whether unemployment insurance or sick leave policies apply to undocumented workers. Again, unfortunately, unemployment insurance does not currently apply to undocumented workers. You do have to show proof of work authorization to receive unemployment insurance. However, sick leave does apply to you. Sick leave is employer-provided pay, and you have all the same rights to paid sick days, whether you are documented or undocumented. You also have the right to state disability insurance and paid family leave as long as you've been getting paid on a paycheck.
All right, thank you so much, Jenna. That's really important information. Back to Shanae with some more questions for tenants and tenant rights.
So we received a couple of questions about the states will rent costs that exceed small claims court limit be able to be recovered. And so this is a question from YouTube, and what I would say is that if the cost exceeds small claims court, then you go into the limited jurisdiction. Small claims court, you're not allowed to have an attorney, but if the cost exceeds small claims court, you are able to have an attorney. So we would, highly recommend that if this is a property owner who is making this request, if you are looking to recover costs of rent that hadn't been paid during this local emergency, you really should talk to an attorney if those costs exceed small claims court allowances. Additionally, we do want to encourage and continue to encourage folks to try to work it out. Try to speak with property owners and tenants, try to work together to create a payment plan or some type of way so that the rent can be paid and we ensure that people remain in their housing. We have an additional question on the same theme from Twitter stating what will happen after rent moratorium is up. I heard it will be counted as consumer debt. So yes, after the moratorium, it isn't a rent moratorium, actually it is an eviction moratorium. So a tenant cannot be evicted during the local emergency. You will not lose your housing during the local emergency. If your inability to pay rent, if you can prove that it was directly related to this local emergency, then it is a complete defense to the eviction. However, the debt is not completely forgiven. You will remain liable. It will be liable in civil court, not as a debt, not as an unlawful detainer, which is an eviction. So it is important, like we said, to try to work things out with the property owner. Also, it is important for tenants to keep records during this time because it is a defense. And so if you are faced with an unlawful detainer, you will have to defend yourself and prove that your inability to pay rent was a result of the local emergency.
All right, I just want to recognize that we are getting close to 8 o'clock, which is the end of this town hall. I think we have a last set of questions for our Chief Resilience Officer, Alex McBride. Thank you, Alex.
Thanks. I'm just going back to a few questions that were submitted before we started our call tonight. One is around grocery store lines or supplies. I want to remind everyone that we had Assemblyman Rob Bonta here last week talking about our grocery stores and how it's important to not feel pressured to hoard items. The grocery stores are still operating. They are still, thank you, they're still able to maintain supply. So we do ask for our Oaklanders to be responsible and to allow everyone to access products every couple weeks for you to go to the grocery store and not hoard. So just there are a couple of questions about that and wanted to respond. I think now, though, we are, just sort of sharing some wrap-up comments. And I know one takeaway from me, I remain in awe of all of my colleagues. I also am trying to find a way to ensure that folks who don't have the internet or who weren't able to join the town hall are able to get these resources. And we're using our online presence, but we're also trying to think creatively using the Oakland Relief Fund to use these community groups that already have deep ties with these communities on the ground and ensure that this information is shared appropriately. So it's I think, really important for us all to consider that we can't do it alone and that these resources are gonna come from so many different places. I learned a lot this evening, and I'm really excited to try to get that information out to as many people as possible and being as thoughtful and creative in doing that.
No, thank you so much, Alex, and thank you just for all the hard work everybody is doing right now. It is time for us to wrap up tonight. I hope that you learned something helpful tonight. Please spread this information. Information is power. This is a time of so much anxiety and uncertainty. And so understanding that these new resources are coming online. Tomorrow, 2 huge things are going to happen. The Congress is likely to pass an unprecedented relief bill, and the Oakland City Council is likely to enact a very broad and powerful eviction moratorium, not just for residential renters, but also for our small businesses, for commercial renters. So 2 big things happening tomorrow. Everything is changing every day during this health crisis. And so we really want to know from you, what is the most helpful information that we can be getting to you? How can we be doing it? And so we will be posting on the different mediums that everyone has been viewing us on, a survey. And we ask you to answer that survey and even pass it on to people that didn't watch the town hall tonight. We want to know how we can do a better job of getting you the information that you want during this health crisis. So please answer our survey, share it on Nextdoor, at the laundromat, amongst your friends that you are probably Zooming with, that we are connecting with virtually. Please stay home, stay healthy, be kind, check up on everyone, and let us get through this. We will get through this together. Thank you for joining us for our second City of Oakland COVID-19 Town Hall. Thank you so much. Thank you everybody who helped make this happen. We are all 6 feet apart from each other, but there is a lot of love in this room. Our fabulous interns, our fabulous staff, Ivana Caceres, Director of Community Engagement. Woo! Thank you, everybody, and have a good night.